can I manage pain from Ehlers-Danlos Syndrome? That is the question we are diving into today on Ask a Doc. I'm Dr. Michael Smith, a naturopathic physician on a mission to help individuals and families achieve health and wellness across the lifespan and throughout generations. Now, if you're familiar with Ehlers-Danlos Syndrome at all, it definitely affects the lifespan and it can affect generations. So it's an important disease condition to understand and know how we can support the people that have it. It doesn't define any one person. We are first a human being, and then somebody who has Ehlers-Danlos Syndrome is a human with Ehlers-Danlos, and it's not a fun condition to have. I don't personally have it, but I've known several people who do. It's not fun, fairly debilitating. And my goal as a physician is to help you or those people with Ehlers-Danlos Syndrome manage their pain, manage their symptoms, and feel and live the best way that we can. What is Ehlers-Danlos Syndrome, or EDS as I'm going to call it? Ehlers-Danlos Syndrome is a condition that affects the connective tissue in our body. Connective tissue, I'm going to use it kind of like a balloon. It provides some elasticity to our structure, our body. We find this connective tissue, or otherwise known as collagen, in our muscles, around our nerves, in our blood vessels, in our GI tract, in our eyes, in our bones, in our muscles. Did I miss anything? It's everywhere. And when this breaks down, the structure of our organs, our vasculature, our blood vessels is not able to hold its shape as well. I'm using a balloon right here just to kind of depict how these connective tissue works. Is that imagine this balloon getting really loose, the air can just move wherever it wants to in a balloon. Think about that if this was like a blood vessel with blood moving through it. The blood can stretch out and cause the blood vessel to expand. Things don't work as well as they should. And we get a host of different problems that is caused by EDS. So what is EDS and where do we get it from? Ehlers-Danlos Syndrome, EDS, is genetic. It is autosomal dominant, so that meaning that somebody who has EDS got one of their alleles for a particular gene from one of their parents. Now, there are some cases where EDS just happens spontaneously, but most often it's inherited. Now, there's different subtypes of EDS, about 12 or so, each of which has a different physical presentation. I'm not going to dive into those details today, but we're going to talk generally, specifically about how a naturopathic physician can help somebody with EDS manage their symptoms, manage their pain, and feel as well as they can. On the note of genetics, we have our genes, 23 pairs of chromosomes in each one of our cells in our body. They are the blueprint for our lives. However, do they need to define exactly who we are and how we feel and things like that? I don't like to think so. This idea is called epigenetics. You may have heard of the book Dirty Genes by Dr. Ben Lynch. I'm just reading this right now. I think it's an amazing book so far with what I've read. I'm about a quarter of the way through. But he writes a whole book about epigenetics. Epigenetics is also the subject of my master's thesis, and I've been really become really familiar with it in my research and my clinical training. Dr. Lynch, in this book, he talks about how genes don't need to define us. We are not directly a product of our genes. And in many ways, the gene sequence, it can be turned on or off depending on different molecules that are attached to our DNA. That is the basic essence of epigenetics. How can we do that? How can we change whether genes are turned on or off? A lot of it happens through our diet, our lifestyle, and things around us, chemicals that we're exposed to. And he dives into this a lot more. I'm not going to go into it too much more, but I invite you to check out this book. I'll put the link in the video description below if you're interested. So how would I approach somebody with EDS? Building on the foundation, the idea that we can modify our genes to a point by turning them on or off through how we live. Naturopathic medicine is really built on the idea and the principles of treating the whole person. We don't just focus on the heart. We don't just focus on the skin. We don't just focus on the GI tract. We're looking at everything all at once because our body's connected. I like to think of it as a big 3D spider web, and then we pull on one part, it affects everything else. As a naturopathic physician, I really try to treat the root cause of the condition, diving in, looking at labs, looking at everything else, seeing what might be causing this to happen. We try to prevent disease when possible. Where there's a condition that's genetic, somebody grows into it, it starts manifesting more throughout their maybe adult life. We try to prevent downstream effects that it might cause and try to keep them as healthy as possible. There's a lot that we can do with a naturopathic medical perspective to help support patients with Ehlers-Danlos Syndrome. Now, when you build a building, you don't just put a bunch of boards on the ground and then just start building. You really need to build a foundation. And naturopathic medicine really focuses on that foundation of sleep, that foundation of diet, that foundation of movement, stress relieving, stress reduction. We try to help patients build and strengthen their foundations, because if their foundation is strong, the rest of them will be better able to manage life and have a better chance of healing. As a naturopathic physician, I look at that whole picture, and those are my main priorities when working with patients. With Ehlers-Danlos syndrome, with other just general inflammatory conditions where there's pain, I want to help patients reduce that pain and reduce that inflammation. There's a lot that we can do simply even by diet. There's an anti-inflammatory diet. It's not necessarily a formal diet per se, it kind of is, but avoiding foods that cause inflammation. Some of these might include dairy, might include sugar, eggs might be inflammatory for some people. Anything that we're allergic or sensitive to is causing an allergic response. That's kind of leading and contributing to inflammation, which we don't want. So watching what our diet is like can help manage inflammation. There's some other supplements. Curcumin is turmeric. Curcumin is one that I like to use for some patients. They find that helpful in decreasing their inflammatory load. One of my favorite go-tos for this type of condition when there's chronic pain is actually something called low-dose naltrexone, or LDN for short. LDN is the low-dose form of naltrexone. Naltrexone is a drug that acts on the opioid receptors in our body. And opioid receptors are involved with pain, among many other things. So when somebody has a big pain-inducing event, like say a surgery, opioids are sometimes considered for helping relieve that pain because they bind to those opioid receptors. Now, that is like a higher dose, like 25 or 50 or even 100 milligrams of naltrexone, a drug that's commonly specifically used for addiction recovery. When we take a low dose, it actually acts as an immunomodulator. It modulates our immune system and helps actually strengthen our immune system to better handle inflammation, pain, and so many other things. Um, the when we're talking low dose, we're talking like 1.5 to maybe like 4.5 milligrams, like really small, um, compared to like 25, 50, 100. So they're low dose. But even though the low dose of the naltrexone can bind to those opioid receptors, it causes increases of endorphin release, which then affects the number of opioid receptors, and it just helps strengthen the opioid and immune cascade and helps with pain management. There's a great website called the LDN Research Trust. I'll link it down below. That has a ton of information. I invite you to check it out in case you're interested. When I'm also thinking about other ways of supporting somebody with EDS, I love to use homeopathy. Homeopathy is using micro doses of substances, whether they're plants, minerals, maybe animal products, to support the body's healing process. Our bodies are innately able to heal themselves, and homeopathy the philosophy is intended to support the body's ability to heal itself. I love it. It works well. I've seen it work with myself, with my family, with many patients that I've worked with, and it's one of my go-tos. So to better understand which homeopathic remedy might be best, I would need to sit down with a patient and talk to them more, to ask some in-depth questions and learn about what's really the focus of their pain, of their symptoms, and really curate and identify a treatment that works really well for them. So that's homeopathy. One of the most common effects of EDS is joint pain. When joints become hypermobile, they can bend in ways that they're not intended to. One of the most common is being able to push your thumb back to your wrist. I can't do it fully, but people with hypermobile EDS are able to do that in many cases. Supporting their joints. And there's many different ways that we can do that, whether it's hot or cold water, alternating hot and cold, baths like Epsom salts, electrical stimulation like TENS unit, really gentle like buzzing of electrical current to help relax muscles and stimulate blood flow to that area. Massage, things like that. Those can also help with pain as well. I always like to support the patient's mental state. Our minds are connected deeply with our bodies, and if our bodies are in pain, it's going to be harder for our minds to be well and to have really good mental health. So seeking help from a cognitive behavioral therapist, CBT, or other types of mental health support can be really helpful as well. Lastly, one of my go-tos for anything is acupuncture. During my naturopathic medical training, I took some elective classes in Chinese medicine. I think it's an amazing science of helping support people in a very gentle, holistic way. I'm not a licensed acupuncturist or anything, but I have a deep respect for that profession, and I refer to patients to go get support with pain through acupuncture and other Chinese medicine modalities, Chinese herbs, and other things like that. EDS can be really hard. Like I said, I don't know that specifically from my personal experience, but I know it from watching and hearing about the experiences of so many other people. My heart goes out to those, to you who may be listening, who have that, and I want to help support that as much as I'm able. We may not be able to change the genetics, we can influence the epigenetics, and we can do a lot to support symptoms. And that is the goal of naturopathic medicine, especially when we're focusing on helping support somebody with Ehlers-Danlos Syndrome. Thanks for joining me today on Ask a Doc. If you have a question that you want me to answer, feel free to put it in the chat below, and I will love to hear your questions and answer them the best that I can. Have a wonderful day.